Have you ever wondered why some celebrities look like they never age, yet others look overdone? Well, here's a few thoughts about how to maintain that timeless elegance of looking refreshed. Hi, I'm Dr. Athre. I'm a double board certified facial plastic surgeon practicing here in Houston, Texas. Many times when I do a consultation, I frequently get things like, oh my God, I don't want to look like that celebrity. Am I gonna look like this? So these are common things that I hear from patients as they talk about their fears and apprehensions as we discuss potential therapies. So as we go down this road, I have done a lot of research on why do some celebrities look amazing for long periods of time, whereas other ones just don't look like themselves. So I've kind of put together kind of a list of things that I think help maintain that timeless elegance look as opposed to jumping around. First of all, most celebrities, as they are preparing for movies and things like that, they have a very fixed schedule. So things like nutrition, working out, those kinds of things are things that they think about on a daily basis. I think there was a recent thing about what Tom Cruise really had to do for the Mission Impossible videos. I mean, his training routine and his diet is insane. Same thing happens for these guys that do like the James Bond, right? So similarly, these celebrities are very used to having routines in order to be at peak performance. So one of the things that's added into the routine from a very, very early on time frame is skincare. So a lot of celebrities spend a lot of time on their skin because this is, for lack of better words, their moneymaker, right? So they want to look their best. So therefore, they're spending that time and energy with quality skincare, medical grade skincare to not only protect their skin, but also minimize collagen degradation, elastin degradation, and maintain that fresh plump. Now, on a sidebar here, just for anybody watching this video, just because you do all of these things doesn't guarantee that you're going to be able to defy aging, number one. And also number two, don't discount the fact that a lot of celebrities have a lot of photoshopping in the photos that you actually see on the internet. So outside of those two caveats, let's go into some of the more long-term kinds of things. So diet, nutrition, skincare, these things are really, really important. Now, the other things that celebrities frequently do is, since their looks are so important, they prioritize this, and this is kind of a chronic daily thing. Just like the skincare, they start early, they maintain it. As opposed to many patients, sometimes what happens is they do this in little spurts of time. So what happens to a lot of my patients is that they kind of go along their gradual process of aging, until they reach a road bump. And then they go, oh my God, I look so much older than I feel, and then they do a massive procedure. It is actually a little easier when you take patients that have maintained for long periods of time and then do a procedure on them, you get better results. So this is another concept that I'm going to kind of bring into this, that maintenance is a lot easier and allows you to maintain that timeless elegance. Now, so far we've talked about maintenance stuff, staying on routine, diet, nutrition. Now let's talk about some of the therapies also that can be used. So first off, I'm a great proponent of microneedling. I think microneedling is one of these procedures that can be started early. It maintains your skin, it promotes collagen synthesis, low downtime, and increases the plump of your skin. Now, is it the fix for everything? No, it's a great maintenance product. Think of fluoride in toothpaste, okay? I mean, it's good to be used on a daily basis. Is it going to prevent you from every single dental problem under the sun? Probably not. Now, so microneedling, I think probably within the course of maybe once every quarter, once every 6 months, just to maintain skin plumpness. Other things, chemical peels. So chemical peels are something that there's a lot of information about, and they've fallen a little bit out of, let's say, common talking points. Everybody jumps straight to lasers, but chemical peels are very, very useful. There are superficial peels that can be used more frequently, and deeper peels that can really attack the deeper layers of the skin, giving you a nice plump, nice collagen synthesis, and giving you that fresh skin look. Moving kind of up that bandwagon also, it would be Botox. I think Botox is a great therapy that can be added in probably as people turn in their mid-30s-ish. There's a lot of talk also about using Botox in the early 30s, late 20s as a preventative. I think there's some value in that as well. And Botox really stops muscle contraction and prevents some of the graining of the skin. So for example, with chronic contraction in this area, you can almost get a permanent crease in the skin, and Botox is really good for softening that and giving a much more natural, softer look. Now, one of the other things that can be done also is fillers. Now, fillers is one of these things that I'm going to include this in this talk as from the standpoint of completeness. And if you had come to my office, say 10 to 15 years ago, I really was a very big proponent of fillers, and I thought that tasteful fillers done softly does add some volume and has value within this rejuvenation spectrum. But the more I have seen the results of the fillers, the more I've seen long-term results, the more I'm operating, the more I'm seeing patients who've had fillers in the past, I'm kind of walking away from that filler market, going more towards fat. I really like fat for the volume replenishment, and the one other aspect of the fat in volume replenishment is that it does have some regenerative potential. So not only is it volumizing and gives you a nice softer volume, but it's also regenerating the tissues, increasing collagen, elastin in its stem cell effect. So I think that all of these modalities are utilized by celebrities in order to maintain some of that timeless elegance. Now, celebrities also use surgery as part of their protocol for maintaining their looks. Many celebrities have facelifts, mid-facelifts. There's a lot of buzz today on TikTok on mid-facelifts, and I think it's a very, very vital procedure, especially to rejuvenate the mid-face portion of the face and this lower eyelid cheek junction, and that's a common area. We include the mid-face lift with almost every 4D lift. It's part of my vector of how I redrape the muscle layers, but these are common things that celebrities use in order to kind of keep them looking great. So let's not forget now about what happens to those celebrities where you look at the picture and you go, what happened? What went wrong? There's this very common thought process that, celebrities make a lot of money. They're able to access the best of the best resources. So patients frequently assume that these celebrities are getting access to the best doctors, the best treatment providers, and going, why did this celebrity end up looking like this? So let's address this straight up. A great example of this, which every time I have a rhinoplasty consultation, this ends up coming into the conversation: what happened with Michael Jackson? Why are we still obsessed with Michael Jackson's nose? Because it looked horrible. What happened? Here's a guy who makes oodles and oodles of money. Why did this guy have such a horrible turnout? Well, I think this is a great point right now to address this face up head on, is the psychological considerations. Celebrities are no different than all of us. They have the same psychological and psychiatric things that they think about, maybe even more so since they're a little bit more obsessed with the way they look. So therefore, this idea of wanting better and better and better and better may not be a reality. There's sometimes patients that I see that I say, that's it, this is enough. We're not going further than this, okay? However, when patients push you and say, hey, no, I want more, it is your ethical and moral responsibility as a doctor to say, this is the limit of what can be done. When you push that boundary, and there are doctors who do that, you end up with problems. Ergo, Michael Jackson. So I've actually seen Michael Jackson's results after his first rhinoplasty. It was a phenomenal job. It really looked good, very natural, achieved all the things that needed to be achieved. But Michael Jackson wanted more. He was not satisfied with that. He wanted thinner. He wanted more. He pushed his treatment providers to deliver more. And at a certain point, that envelope got pushed too far. And that's the point of no return. So a lot of celebrities, I think, because of their incessant, they keep thinking about what they look like, there is a little bit of warping of what their needs and wants are. So sometimes they can push that envelope past that area of naturalness, getting overfilled, too puffy, drawn out, too much stuff in the lips, unnatural muscular movements of the face. So these are very common things, symptoms of being pushed too far past the envelope. And I think another part to this that we need to kind of add to this recipe is there are geographical predilections. And what do I mean by that? For example, here in the South where I practice, the natural look is way more in. Even when it comes to doing things like lip lifts or adding volume to the lips, patients are looking for a more natural look. This might not be the case if I were based in LA, where patients want a more done look. So there are cultural as well as geographical predilections to what patients are expecting. However, I think it is important to keep those psychological considerations in mind, because once you just kind of want more than what is advised, that unnatural look starts setting in. And it's sometimes really, really hard to go backwards to a more natural look. So the other thing I think is very important is there is a spectrum of rejuvenation that we need to be cognizant of. So for example, we need to have harmony over the entire, not just eyes, but that's to the face, to the lower part of the face, to the upper chest. All of this has to be in balance. So if you take a patient and you do an amazing rejuvenation, however, that's not in balance to other sections, it looks off. It takes these very subtle details. For example, if you're rejuvenating the face, thinking about rejuvenating the lip complex and whether that lip complex is in balance with the rest of the face over the look and the perceived age of the face, so that it all matches together. And this is where we balance that science art seesaw and making sure that we're on that seesaw and taking both of these variables in and going, what is aesthetically pleasing, what is possible scientifically, and delivering the best results. So here's a kind of a long, kind of drawn out idea of how to achieve some of these long-term timeless looks. So going back and kind of recapping a little bit, one, routine. Maintain good diet, good nutrition. Why that's even more important is patients that kind of have this bang weight over their life where they go up very high, down very low, up very high, down very low. You will see kind of a more exaggerated aging, and you will see a more exaggerated rejuvenation when it's done. To have more of this kind of small sine wave or small wave, you get a much more long-term timeless elegance. Along with that, skincare, minor procedures, things like Botox, things like volume replenishment with maybe a little bit of fat, maybe a little stem cell microneedling, all things that can be done very easily to maintain quality and give you that smooth, plump look for the longest period of time. There is a point, however, when you cross that and need maybe a little bit more, and this is where going to someone who's very skilled in facial rejuvenation, has a lot of experience in facial rejuvenation, where we look at potential surgical procedures to achieve that very harmonious result, whether it's in the eyes, the mid-face, the jawline, the neck, the lips, and kind of putting it all together, even skin quality, the skin envelope, so that it looks seamless. It's not just where the scars are, it's how the whole face looks in relation to the rest of the body. So I truly hope that this has been helpful as you navigate all the questions and concerns you may have as you're looking at facial rejuvenation, whether it's for you or just looking at the stars and celebrities and seeing what they had done. So if you liked this content, if you found it interesting, you said, God, I want to know more, hit the subscribe button. You have comments, you have questions, please hit them in the comments down below, and we will try to answer them as soon soon as possible. And one of the things we talked about in this video is fat transfer. I do a lot of fat transfer. I think it's a great procedure. If you're interested in knowing a little bit about fat transfer, here, click on this video right here. I'm Dr. Athre, ATHRÉ Facial Plastics, Houston, Texas. Looking forward to meeting you online.